key that WHO insists on emphasizing is that salt ionization is the key strategy to eliminate iodine deficiency disorders. And in countries where USI, or salt ionization, has been effective for at least 2 years, where salt is adequately iodized, it's consumed by at least 90% of the population, and the median UI is at least 100 micrograms per liter in children, then it's assumed that the iodine needs of pregnant and lactating women are adequately covered, and the dietary iodine, together with existing thyroid iodine stores, will be adequate for thyroid hormone synthesis. Now, in areas where these criteria are not met, for example, in areas where the median is less than 100 micrograms per liter in school children, then WHO does recommend iodine supplementation for women of childbearing age and for women who are pregnant or lactating. And they recommend either a single annual oral dose of iodized oil or daily oral potassium iodide so that the total iodine intake meets the RNI of 150 micrograms per day. Recommendations from the American Thyroid Association are that until we have more data on whether mild iodine deficiency potentially puts the offspring at risk, we should supplement. And pregnant women should receive iodine supplements 150 micrograms per day, both during pregnancy and lactation. The ATA has also been focusing on improving the iodine content of prenatal vitamin and mineral preparations in the U.S., emphasizing that it's important that they contain at least 150 micrograms of iodine. Spanish recommendations from the IBD working group of the SDEN are for an iodine supplement of at least 150 micrograms per day for both pregnant and lactating women. So I think to finish up, we have some research questions still out there that need answering. First of all, what is the target audience? Is it pregnant women? If we just recommend iodine supplements for pregnant women, typically who are getting a diagnosis of pregnancy around week 10 to 12 to 14, is this early enough, or are we missing a critical early period of fetal brain development? So should we be recommending iodine supplements for all women of childbearing age? Should we be recommending them for women who are trying to become pregnant? Should it just be pregnancy? Also, whenever we recommend supplementation policy, it's always difficult to know if it will reach women who need it the most, and that is usually women who are marginalized or the lower socioeconomic levels of society. We don't know really the optimal dose or bioavailability of iodine supplements, and we don't know much about potential nutrient interactions with iron and selenium deficiency, for example, during pregnancy. And as I mentioned earlier, we don't have any long-term clinical outcome data yet. But I think our policy at this point, when the iodine supply remains unclear to pregnant women, we should err on the side of caution and supplement with at least 150 micrograms of iodine per day, both to pregnant women and those women who are planning pregnancy. We should encourage prenatal supplement manufacturers to include adequate iodine in their products. But I think also these data emphasize that iodized salt remains the key strategy, and we have to really focus on making sure that iodized salt is available and used by women of childbearing age and pregnancy. Just to finish up, the 2007 International Child Development Steering Group looked at strategies to avoid the loss of developmental potential in children in the developing world, and they identified iodine deficiency as one of 4 clear global risk factors for impaired child development. And a quote from this Lancet article is essentially that salt ionization remains the most cost-effective way to deliver iodine and improve cognition in children. So this re-emphasizes the importance of iodized salts. This shows you an advertisement from Morton Salt in the United States from the early 1920s, and the byline here was brilliance for little minds and strength for little bodies, and I think this still holds true today. So I'd like to thank you very much for your attention. I've been told that I can't take any questions, but if you have any need for any more information, we have written 2 recent reviews on iodine deficiency, which I refer you to. So thank you very much.